Chapter 7, Early Adulthood Physical Development. So, in this section, we will discuss an overview of physical development, the physical milestones in early adulthood, physical growth, and health issues. So, an overview of physical development. Physical development is the physical growth from birth to adulthood. It's the development of both gross and fine motor skills, gross being the larger movements and fine being the coordination of small movements, and the progress of one's control of the body. So let's look at some of the milestones that happen in early adulthood. Well, in early adulthood, physical functioning increases through the 20s and peaks at about age 30, but it can be maintained through exercise. Body shapes are changing, and there's a gradual increase in weight and body fat and decreases in lean muscle mass. The efficiency of many organ systems begin to diminish at about a rate of 1% a year. Sexual responsiveness remains high throughout this period. And then physical appearance also changes. Graying hair and wrinkles do start to develop towards the end of early adulthood. So, physical growth in early adulthood. Well, there is a peak and a decline in early adulthood. And this period is of great strength and good health. Most physical growth ceases before early adulthood begins, but physical maturity in height and weight has been reached. So, maturity is the completion of all growth and developmental change associated with attaining adulthood. Now, there are many physical changes in appearance during this time. So, there's changes to the senses, to the teeth, the cardiovascular system, lung, skin, and muscle strength and physical performance in early adulthood. So let's start with senses. There's a gradual loss of accommodation, and this refers to the dilation and the construction of the pupils to see at different distances. So this is where some people start getting glasses because they may be nearsighted or farsighted. And they may not be able to focus properly or quickly enough. Another thing that changes is the sharpness of the vision. It's at its peak in early adulthood, and men have a better sharpness of vision than women do. But both sexes start noticing a decrease in the sharpness of their vision during early adulthood, especially towards the end. Another thing that's happening during this time is they're starting to have a difficulty in perceiving objects that are close. And there's deficiencies in distant perceptions between the ages of 35 and 40. And symptoms of this could be them holding objects really close to their face, especially when they're reading or trying to look at something to follow the directions of how to build something or put something together. The whole thing's really close to their face. Now, this condition is corrected with corrective lenses and reading glasses. And most people that need glasses begin wearing them around the age of 29. And at this age, contacts are more popular than wearing glasses. So, senses changing in regard to hearing. Now, hearing loss does become apparent during this stage, typically around the age of 25. But at around 30, they can still hear whispers, but as they get older, the ability to be able to hear and understand whispers does go down. And there is also a noticeable change in their ability to hear high frequency tones. Now, men do have a greater loss of hearing than women do. And this is primarily due to their work environment. So if they work in a place where the machines are loud or they may be jackhammering all the time, there could be many different things. But depending on the sounds that they hear while they're at work will have an impact on their ears. So when parents used to tell you, don't listen to the volume in your headphones so loud it could cause hearing loss, that is actually true because it does impact our ability to hear in the future. And as you can tell by this chart, in our 20s, we can hear some pretty high frequencies. But there is a big decrease going into middle adulthood and into late adulthood. So there's a lot of loss in those abilities to be able to hear these sounds. So changes to teeth. Well, during this age, most people retain their permanent teeth that they had in early childhood. Now, tooth loss is more likely in women, and this is due to pregnancy because of the loss of or the lack of calcium, because the calcium is going to the baby instead of to the woman. So there is an increase of cavities and fillings, and also some periodontal diseases also increase. And this is just a disease that's caused by improper hygiene. So, not flossing or not brushing or not rinsing properly. And it's an inflammation of the gums and the tissues around. And if it's not treated, it can lead to significant tooth loss, especially as you continue to age. So, for pregnant women, they highly suggest that you take supplements for calcium and you eat things that are fortified with calcium as well to make up for those changes. Men, same thing goes. If you don't eat a lot of calcium or intake a lot of calcium supplements and eating things that are fortified or drinking things that are fortified is also good for bone and teeth. So changes in the cardiovascular system. Now, during this time, hearts become more sluggish at pumping blood. And this explains why a lot of older adults are unable to sustain large workloads for long periods of time. They need to take more rest and breaks because the heart it's really starting to really slow down in regard to the pumping. It's a lot slower. Now, they are at this age at risk of getting diseases that affect the heart and the circular system. Blood pressure rises as a part of the natural aging process, and they're more susceptible to hypertension. Now, hypertension is when you have abnormally high blood pressure, and it's caused by constriction to the arteries. Now, this can increase a lot of things like kidney damage, heart failure, brain damage due to a stroke, and it is known as a silent disease, a silent killer, because there are no signs that are readily observed. The only way to know if you are at risk of hypertension is to get your blood pressure checked often. So it is treated by drug therapy and dietary changes, but it does require constant monitoring of blood pressure. So changes to the lungs. Now, lungs play an important part in the body's ability to sustain exercise and work. It's how we breathe and how we function. Now, in early adulthood, it does begin to function less efficiently towards the end. Young adults are able to absorb 4.5 times more oxygen than older adults. And this decline in oxygen absorption is due to a lowering amount of blood pumped to the lungs. So, because the heart is starting to slow down, the amount of blood pumped to the lungs is also starting to slow down as well. So, it's causing that deficit in oxygen absorption. Also, there's losses to the mechanical efficiency of the organs as people age. The body ages on the inside and the outside. Smoking and also secondhand smoke is also part of why there's a decline in oxygen absorption. Now, younger adults have a greater success at quitting smoking than later in adulthood because it's become a habit, it's become part of what it is or who they are, and they don't believe that they can stop, or they don't see a purpose of stopping because the damage has already been done, or they don't want to change their ways. Now, there are lots of things that can help a person with quitting smoking. They can do it on their own, or they can do it with medical drug intervention, such as the gum, or they also have a supplement for cigarettes, trying to keep people off of it. But it all depends on the person's motivation for wanting to quit and wanting to try. But it does have a big impact on lungs and their efficiency. Now, changes to skin. Now, during early adulthood, there are some signs of aging. Wrinkles are one of the first things that people start to notice. especially wrinkles around the eyes and the hands. Skin also begins to loosen and it loses its fine texture towards the end. And most people during this time, they do recover from acne and related skin disorders that were common in adolescence. But some people do have adult acne, but most people do recover from that. But now there's wrinkles and losing the fine texture of the skin. Now, common skin disorders in early adulthood are fungal infections and tumors. Now, these are more common in men than women due to the working conditions and to hygiene. A lot of these different things some of these things just happen, some of these things could be corrected with proper hygiene. So, changes to muscular system and physical performance. Now, during the ages of 20 to 30, that is peak muscular strength. And there is a gradual decline until old age when decline becomes rapid. Muscular strength is different than work rate, and the power output declines after 40 and into middle and late adulthood. Now, what this looks like is that there's a loss of muscle mass, and it will get worse as you age. There's also weak points in muscles that spread, including the arms, neck, back, and chest. And frequent falls might also occur due to the loss of balance and muscle weakness. So keeping up muscle strength and keeping all that up is very important as you get older. And then the fat and tissue as well, replace muscle tissue as time goes by. So that kind of golden thing that people hear a lot, if you don't use it, you lose it, is very important. So being able to keep it up and try to stay in peak performance is important, because if you don't use it, you are going to lose it. But as you get older, your body is also going to change on the inside as well. So we're going to pause and process what we have covered so far. So go back and review as needed to answer these questions. So let's look at some health issues in early adulthood. So accidents are still one of the leading causes of death for this age group. Diseases are also a cause of health problems, especially when it comes to upper respiratory problems, flu, STDs, and infertility. Now, accidents they're either an unforeseen event, a chance, or an unexpected happening. Now, some of these are predictable, so they're logical based off of what's going on in the environment, such as a hazardous condition, or knowing that if you're climbing on a ladder and you're not paying attention, you could fall. That would be kind of predictable. Now, preventable and avoidable. Hazards that do not have to exist are part of it. So like a wet floor, or putting something that could cause somebody to trip. These are caused by things people do, not because of the roads being wet. So stress is one of the main things that does occur in early adulthood. And stress refers to any psychological or any reactions that an individual has in regard to the demands made on him or her. So it's their reactions to these demands. Now, stressors are events that cause stress reactions. So this could be work-related, kid-related, school-related, anything that causes stress in a person. Now, stress in itself is not necessarily harmful, and it can be a motivator. However, the more severe the stress is, or the more prolonged the stress is, the more negative effects on well-being that it can have. So there are lots of effects of stress. So heart disease, hypertension, migraines, ulcers, asthma, depression, lower immune system. There's lots of things that stress can cause on the body. So reactions to stress, these are different based off people's personalities. So there's 4 main personalities that people tend to have. However, some people do have a combination of some of these types as well. So type A is a self-driven, competitive type. Type B is very charismatic and easygoing. Type C is introverted, they're stress prone. And then type D love routines and like to follow orders. So a type A personality. This is a person that is highly competitive, they're restless, and they're achievement oriented. They're ambitious, competitive, and they often perceive that others are attacking them and react hostilely. Due to this, they have a higher risk of heart attack and cardiovascular disease, high blood pressure, and levels of stress hormones in their blood as well. So they're more out to have stress due to that competitiveness and goal-oriented mentality. Now, a type B personality, they're low in hostility and aggression and moderately ambitious, but they're more relaxed, cheerful, patient. They may be considered a procrastinator or just too casual in nature. They're the total opposite of type A. Due to their mannerisms, they're less likely to have heart attacks and cardiovascular diseases than type A personalities. Type C, these people tend to be very introverted and eager to please others, and they often repress their emotions and their stress. Now, due to this, they are more associated with an increased risk for cancer, and they have a poorer coping mechanism when it comes to those. They're more introverted and they're very systematic and thoughtful and critical of what's going on, but they tend to have it on the inside and try to please other people. Now, a type D personality, these are people that prefer to stick to routines and don't like change. They tend to be a follower and prefer to be under the direction of other people. They're less likely to take responsibility and risk, and they're afflicted by negativity. So they're very much distressed and negative and pessimistic about their abilities. And they try to avoid rejection. They avoid opening up and sharing things because they're afraid that people may look at them in a different way. Now, they suffer enormously from stress, and they're prone to more heart related diseases due to keeping that stress on the inside. Now, reactions to stress continued. Now, multiple stressful events in a short amount of time can also cause certain reactions, but also the interpretation of these life events. So, what is distressing to one person may not be to another person, and how one may cope with stress may be the key to their personality styles and to the event. And then their sense of control is also important when it comes to coping with stress. Now, there's lots of things that people can do to alleviate stress in their life or to step back and to look at it in a different way. So, things like meditation, blogging, massages, exercise, dieting, going to counseling, learning time management strategies, and then avoiding drugs and stimulants. So, not putting something in to make the stress go away, but learning how to deal with the stress is important as well. So, during early adulthood, this is the time for college students. And college, as many of us know, is a very common stressor. And 30% of freshmen in college report having a lot of stress. Now, chronic stress can lead to depression. And there's many factors to stress in college. It could be unhealthy behaviors. Going into college, you may be in a dorm room or you may be living off campus. You aren't required to go to gym class like you may have been in high school. So you may lack regular exercise. You may be more out to have substance abuse. And that doesn't have to be drugs and alcohol. That could also be eating poorly as well. Gaining weight. We've all heard about the freshman 15, primarily because a lot of people stay may stay in their room, or they may start to eat things that aren't as good for them because they don't have somebody to watch what they eat. And then they may also be more out to use stimulants. Another contributor to stress in college would be the lack of social support, especially with freshmen coming in being brand new to an environment. But a lot of colleges try to have activities on campus that help with that. Also, failure to establish relatedness to the college environment. So, not getting involved, not reaching out and trying to find friends and things like that could also contribute to stress. Procrastination or being a perfectionist could also lead to stress. So, not starting on your assignments in time can really be a stress when you realize how much work you have to do. Or learning that there's no such thing as a perfect paper. There's always going to be errors, but those are just rooms for improvement. And then also losing one's sense of humor. There's lots of things that happen that could be considered not as big of a deal, but it could seem like the end of the world in a new environment where you're not feeling as if you belong. So, mental health depression. So, depression is a disease that involves a person's thoughts, emotions, and feelings. And approximately 9.5% of all U.S. adults suffer from depression. And 1 out of every 10 are college students. Now, the median age for the onset of depression is about 30 years. That is after you've been in the workforce for a little bit. You may or may not have graduated from college. There's a lot of things, children, and life has changed tremendously for most people by the age of 30. Now, genetic, biochemical, psychological, environmental factors also play a role in depression. There's not just one thing that causes depression to happen. Now, medication and therapy can help treat depression, and then depression is more serious and may lead to suicidal thoughts and attempts if not treated properly. And there's lots of effects that depression, just like stress, can have on a person's body. It can cause you to have inflammation, swell up, insomnia, headaches, fatigue, pain, heart disease, weight loss or weight gain, being nauseous, losing your libido, diarrhea, constipation. There's a lot of things. What we're feeling, our body feels that too, and it will start to show. So, nutritional needs are an important thing to talk about in early adulthood as well, because calories that are needed for normal functioning does begin to reach a plateau in early adulthood. And a bulk of the calories are used to perform the daily life and work tasks. Now, any calories that are above that are stored in, they're metabolized into fat and stored in the body. Now, fat storage becomes more prominent as weight is gained. Now, men do tend to accumulate more fat in the abdominal area, and women tend to accumulate it in the abdominal, hips, and thighs. Now, a healthy diet can prevent certain diseases during middle and late adulthood as well. So, having a healthy diet in not early childhood, but early adulthood, going into the rest of the life is very important. And as we can see, depending on the lifestyle that we lead, there's a certain amount of calories that we should be taking in each day. And if we go back and look at how many calories are in a McDonald's menu item or combo, one meal would pretty much fill most of these calorie intakes. So one of the main reasons that so many people are overweight and obese is that they don't realize that what they're putting into their body is not needed. And again, life gets in the way sometimes, and quick meals are put in instead of healthy meals. But knowing why this is happening to your body and knowing how to change it and make healthier choices for yourself throughout the rest of your life is very important. So, health and risky behaviors in early adulthood. Well, a healthy behavior is any behavior that reduces the susceptibility to disease and enhances physical and psychological function and well being. So these are things like diet, exercise, and stress regulation strategies. Now, risky behavior is any behavior that is detrimental. So it causes harm to your body. So, drugs, alcohol, obesity, poor eating habits, unsafe sex practices, lack of safety equipment and seatbelts, fighting. Those are all considered risky behaviors. Now, sexually transmitted diseases are really becoming an epidemic in the United States. And this is for many different reasons. One, talking about sex is not necessarily, as we learn from adolescents, taken in the same approach from state by state. So there's a lot of people who were adolescents moving into early adulthood that do not understand how babies are made, don't understand how STDs and STIs are transmitted, don't know safe sex practices, or they may not even have access to these things to protect themselves. Now, 25 diseases are now spread through sexual activity. So the CDC, the Center for Disease Control, has reported that there are over 65 million people that have an incurable STD, and that each year over 15 million people contract at least one, and 50% of these will be lifelong infections. And looking at these statistics alone, these are from 2016. But look at how many cases and how much of an increase there has been in chlamydia and gonorrhea and syphilis. And this is because of not knowing or not really understanding how these are transmitted. So, sexually transmitted diseases are passed from one person to another through sexual activity, including vaginal, oral, and anal sex, and also vaginal birth deliveries. Now, it can also be passed through intimate physical contact, so heavy petting. Even though it's not common, it can still be passed that way. Now, STDs don't always cause symptoms or may only cause mild symptoms. So some people do not even know that they have an STD or an STI. And if you are diagnosed with an STD, knowing whether or not it can be treated with medication or cured entirely is very important. Now, one of the main things is STDs are preventable. If you have sex, know how to protect yourself and your partner. Using condoms is very, very important. A long time ago, back in the 70s and 80s, women were told to use douches. However, that is not common anymore. So some of these old practices are not as relevant today with all the new information. Making sure that you constantly are staying in monogamous relationships. Knowing who you are having sex with is very important as well, especially with concepts such as open relationships. Well, you don't know what's going on with other partners, and they could be bringing something in that you didn't know about. Also, making sure that you clean things, making sure that they're safe to use. Open communication, knowing your status, being careful with alcohol and drugs because we're out to do risky things when those occur. So once again, let's pause and process what we have talked about so far. Go back and review as needed to answer these questions. And that is the end of this section.